Hi everyone, we'll cover the RT220 to-do list for you so that you're aware what is needed to help our students make it through the RT220 course. As a reminder, the students do need 35 hours total to finish the rotation, and it stretches for 7 weeks only and 5 hours per day. It's very doable for the students. They don't feel overwhelmed. They're able to attend lab and they're not tired. So this was originally designed to make sure that our students get that practice, beginning clinical practice, to kind of start breaking their out of their shell, as to say, saying hello to the patient, approaching them for the pulse. The whole patient care starts at the bedside when you're at the door. So without further ado, just remember that you're seeing them the whole time for the 5 hours, and you're just taking them to different areas of the hospital. One could be with an RT doing a neb treatment or looking at a BiPAP. It's more, they wouldn't know what to do, but they're observing. So at the end of it, you're doing the final affective evaluation on DataArc. You're supposed to send that email to them, welcoming them. I will introduce you to your group, but it's very important that you are welcoming the students with all the correct information, because I don't know which shifts that you prefer, because your hours are really up to you. As long as the students get to see some sort of shift exchange and they get to really feel what it is like to be an RT. So provide them with the phone number to call if they're sick and not to leave a voice message. We teach them that too, but you have the similar message. I'm gonna scroll down a little bit here. You do have a template you can use and fill it out. The most important is the number to call, and if you want to share your number, it's totally up to you. And where to park, things like that is what you're really emailing them with. Plus, they get to hear from you and they totally feel more confident that I have somebody there. Okay, the next thing is you're meeting with them on Wednesday. Let's just say for every single week, you have to bind a schedule. If you want to choose Fridays, please do talk to me, which is fine. I would have to really check and make sure they're not busy. The curriculum has changed, and we can work something out. Um, the yellow card that they bring with their yellow packet is every single day that you're signing. There's an extra video I've attached at the bottom. You can look at that. But make sure you're signing it for them and every single day that they're there with you. And obviously looking for, are they late? How's their uniform? How's their hair? How's their behavior? Keep track of assignments. You're not really there to ask them, hey, did you do the assignment every single day? It's more of like you have an assignment, which is the director interview and the patient interview. So you would help them get the director interview and they would be asking the questions. The patient interview, you have to do it. You have to demo a patient interview, and they need to take notes on what were the questions you asked, how did you approach the patient, and how to do a successful patient interview. Now, I did mention in the other video that COPD patients are some of the best ones that you can use, and sometimes ER patients are really fantastic because that's when you first meet the patient and you have to come up with those questions. So just make it fun and very engaging. And they ask them, hey, what kind of question would you ask? And go meet the patient and interview them together. Yes, you can do it in a group, but I prefer if you do more than one patient, because they just see that pattern over and over again. So if say week one you do a patient interview, probably won't click in for the students. You could do one more, and then you can do it in. You can give one patient to half of the students, the other patient to the other half of the students, and they can write their assignment. Um, the next part here it is that keep track of student progress and check in with staff. So your students will be following staff. For example, they go see a bronch, that they're just observing, but they come back to you. You could ask that RT, how was the student? And then you have to keep track of this. I do go over it at the end here. I'm just going to scroll down here. Here's a log, for example. Here's a date, time, the event took place. For example, here, student gave political comment. See, I guided that the student should refrain from making any political comments, and it was noted in the daily progress sheet, which is very important because if you don't document, it means it never happened. So please, just like we do for the patient, here's an example of your daily evaluation sheet. They'll have their goal, but you would put the comments, but you should record this in your records. Make a copy of this, especially when it comes to the negative ones. We don't want them to walk out with this and say, I never knew, that I was not ever notified. So if there is something in the section of needs improvement, unacceptable, and it occurs like once and you're concerned, please feel free to text me or talk to me or call me. I'm always available to guide you with that. So going up here, sorry, that was a little fast. Here we're keeping track of these students because a lot of them complain, I never understood what my assignment was, or I didn't know I was lacking in something. You need to tell them, but you have to meet with the student in private. So say other students are gone somewhere else to another assignment, you can have that private conversation with the student without other nurses listening in. That way they don't feel, there's FREPA laws that protect the student's privacy, kind of like HIPAA. So please keep it private, and write it down in your private notebook that I told the student this and what their reaction was. If at any point you think that the student is not a good listener or the point was not coming across, you can absolutely email them. Hi, dear Sammy, the student, I'm reaching out to you because on XYZ day I noted you did this. Please don't do this and instead do XYZ. So that way it'll help you keep a record. I'm sorry, it really is a manager like job where you're really monitoring their progress. Then there's the final affective evaluation on DataArc. Complete that. Please make sure it's on time because their grades get delayed. And our admissions and records, they expect on time grades. Signs, so their purple packet does have a lot of initials from you. You're gonna have to just do them, please. Only reason is because they are the proof that our student went to the rotations from our board, California Board of Respiratory Care. Instructor must keep a student log, and that must is please do so, because if something were to happen and you're reporting a student, I will be asking you for a log that looks something like this. This is just an example, but basically have something where it says date, time, student event, what happened, how did you guide them, and any outcome. Okay. And I will post this a whole packet online. You still have the data how to video here. If you've forgotten how to do the evaluations, you do also have the yellow card video here, how to do that. Here's your welcome email template. And then last not but least, you do have this, the pink, our lovely sheet, how you get paid. There's a video I have posted on the modules. Please go look at that, how to get paid. It's very specific where you're going to write down the student's name and the course that you taught. Otherwise, Nora is unable to keep track of that. Okay, so going back up here. So throughout the semester, the 7 weeks that the student is with you, document events on the date and the time, like I just mentioned, and then check the daily evaluation sheet. For example, let's say the student went to the Bronc and the RT there thinks that they're not capable and that they don't listen, right? You need to have that feedback. Correct the deficiencies right away. Don't wait. Otherwise, the student will complain and say, I didn't know, and they'll remain in the program. Your job basically is to really safeguard our profession and really want strong, healthy individuals that want to really get into the profession rather than just get by. So I'm sure you will have one or two, but I will make you aware what are the loopholes, what are the things to look out for in a certain type of a student. That we can do on the phone anytime. And then Of course, you're going to ask them about the patient interview and did they write their essay. And then finally, you're done with once you're done with the affective evaluation. If you're failing them in the data arc and the data arc is either 1 or 2 score, we need to have a chat. Just give me a call and we'll figure things out. Thank you so much. Have a good day.